Good morning, everyone. I would like to thank the scientific committee for giving me this opportunity. So macular evaluation in glaucoma patient, that's my topic. I don't have any financial disclosure to make. Should we examine the macula in case of glaucoma? Because main thing, pathology lies in the ganglion cell which die in glaucoma. As a result, the actions of their ganglion cell, nerve fiber layer also gets diminished. So ganglion cell is very much important in glaucoma evaluation, and majority of the entire ganglion cell population reside in macula, and central 20° contains as much as 50% of all the ganglion cell. So it is reasonable to evaluate the macula in glaucoma, and quality of life gets very much diminished if the central vision is affected for the person. So we should be very careful while we observe the macular area. There are certain advantages of the macular imaging. The retinal ganglion cell body is almost 10 to 20 times larger than the axon, that is the nerve fiber. So any change in thickness is easier to detect here. And macula is more uniform, unlike the other like RNFL and optic nerve head among the patients, and the measurement can be repeatable, and it is also less affected by factors like size, tilt, parapapillary atrophy, and presence of blood vessels which are not there, and glial tissue. So why were we not concentrating upon macula till now? Because till the advent of the OCT, which the segmentation is possible, it was not possible to look at the inner layers of the retina, and some misconceptions were also there, that is early glaucoma predominantly affect the peripheral vision. This was so because the routine 24-2 was not adequately sampling the central area. And it was also thought that macula is not involved in the early glaucoma because central vision is preserved till date. But we have to remember the ganglion layer, cell layer is a multiple layer, and till the last layer is gone, the visual defect will not come. So even if we see only a black square in the central area, then so many of the retinal ganglion cells are already dead. So we have to be very careful. And 10-2 can detect central visual field defect earlier than the 24-2. Then Hood came out with an interesting concept. We know that the superior and inferior pole are predominantly affected with the glaucoma, and from the lower macula, it is represented by those fibers come to the inferior pole of the retina. So they come to the more vulnerable zone. So if any damage occurs here, then the macula or central field is affected. But if anything is affected in the superior pole, they go outside the macula. So they will cause the nasal step. So any defect we see here, we have to evaluate the macula properly. Then progression in advanced glaucoma is very important, because in advanced glaucoma patients have only few vision left with them. So the macular analysis is the obvious diagnostic method in evaluating progress in the advanced stage, and patients have some visual acuity visual sensitivity only at macula and the late stage. So we have to be very careful while evaluating, because we have to escalate our treatment so that patient will not go blind due to the advanced stage of the disease. And in this stage, the problem is that we can't see the progression in the optic nerve head and circumpapillary retinal nerve fiber layer due to the floor effect. Floor effect also occurs in case of ganglion cell analysis, but it occurs at a later stage. And moreover, the macular OCT measurements have reproducibility in the advanced stage, but visual field are not like that. So macular imaging is helpful even in the advanced stage. There are some special situations in which the macular imaging is helpful, like in myopia, the morphological change in the optic nerve like the tilted disc, stretching of the circumpapillary retinal nerve fiber layer, and peripapillary atrophy. All this can cause segmentation error and can cause the OCT artifact. So they cannot be relied upon, whereas ganglion cell layer we can analyze. And in myopia also there is temporal displacement of the RNFL peak on thickness plot, causing the typical red disease. So in this case also the ganglion cell analysis is better, and early macular damage in glaucoma patient occur in focal ischemic type and in myopic phenotype of the disc. So these patients should also require ganglion cell analysis. And optic disc hemorrhage and non-motensive glaucoma, we know they also predominantly affect the central vision, so it is helpful in this case also. So the macular ganglion cell analysis is particularly helpful in these situations. Like here you can see the temporal displacement is causing the red disease, but if we take into account these things, then it may be a normal macular, normal OCT picture. So in NTG also the central visual fields affected, but there are certain limitations as with any other diagnostic method. The various types of optic neuropathies, including the comprehensive and ischemic optic neuropathies, can affect the GC-IPL analysis. So here the temporal raphe sign will help, which is typical for the early stage of glaucoma. But here in the picture we can see that the typical temporal visual defect is coming in case of comprehensive neuropathies. So other also we have to think about other coexisting pathologies like macula and scan. They can cause scan artifact and can complicate the analysis. But once we dilate the pupil and see the before going only for the analysis with the OCT, we can know that these conditions can cause artifact, and we have to exclude these conditions from the view. So to conclude, the macular evaluation is very important for the early diagnosis and monitoring progression, particularly in advanced cases, because in glaucoma patient, early diagnosis and monitoring is very much essential in order to diagnose the case. And glaucoma analysis, ganglion cell analysis can help us with this finding. And it's particularly helpful in certain ocular conditions in eyes with high myopia, positive history of disc hemorrhage, and certain optic disc phenotypes in which we should do the ganglion cell analysis. It is complementary to other types of analysis like retinal nerve fiber layer and optic nerve head, but we have to do these conditions. And early glaucoma patients with macular damage should be treated more aggressively to prevent visual disability, because patient is bothered only with their central visual field loss. He is not bothered even if he is having only one nasal step or something, that will not bother him. But even if when he starts deteriorating his quality of central vision, the quality of life is much more affected and he will be concerned. So we have to take this into account so that our glaucoma evaluation will be complete. Thank you.
Thank you so much.